as many people may know, and as some may know, I represent, by many metrics, the most heavily impacted congressional district in America by COVID-19. And I just want to reiterate how important it is that we get health coverage, that we get recurring larger payments, $2,000 per family plus $1,000 per child every month recurring for these families, and to also make sure that we are including immigrants and our immigrant brothers and sisters and neighbors in these bills. The most heavily impacted district and the most heavily impacted zip code in the country is also in my district, and it's heavily immigrant, overwhelmingly people of color. And as we've long been saying, that these inequities are a pre-existing condition. Not having access to healthcare is why people are dying. Not making, having pre-existing conditions because they have confronted the asthma and the elevated lead levels that come from environmental racism and concentrated pollution in communities of color and working class communities is why people are dying. It is the compounding effects and the comorbidities that are leading to the surge of deaths in our communities by COVID-19. But that being said, when we talk about the solutions that Congress needs to have moving forward, I just think it's important for us to say that incrementalism is not helpful in this moment. It's not helpful for people to say, oh, well, we got something, so we might as well support it. We got a nickel, we got a dime in $1 trillion bill, so a nickel is more than nothing, so we should support it, is unacceptable. Not in my community. A nickel doesn't help. It's like putting a Band-Aid on an enormous wound. It's not going to help us. And the thing is that I would be amenable to accepting this kind of logic if Congress actually was in session and convening. But if you're going to say, and if we're going to say that this new bill is going to give us $5 and then Congress is going to peace out for another month-long recess, I'm here to say that that's not going to help our communities. And we have to make sure that we demand meaningful change and meaningful assistance for working families. That means $2,000 a month plus $1,000 for your kids recurring. That means everyone who needs to go to a hospital can go to a hospital without their last words before being intubated being, how much is this going to cost me, which is what is happening in our district. Their last words about being uttered about people being worried about the financial position that they're putting their family in because they contracted a virus that they have no control over contracting. And then lastly, we have to make sure that all people in this country are successfully being covered so that that can enable the public health provisions that are necessary. Because this isn't about who's an immigrant and who's a citizen and who's a legal resident. Coronavirus doesn't care about your status. Coronavirus doesn't ask you for your papers. And if we need to keep people inside, to keep them alive, then we need to give people the economic ability to do so. And we need to be laser focused about that. We cannot roll over to this administration for that. And we cannot bow to the logic that a dime and that a crumb is better than nothing. We need to be able to play hardball so that working families can get meaningful support that they need. I've not seen the final text of this bill, but what I can say is that if it matches up with what has been reported, I will not support this bill. Personally, I'm not speaking for a caucus, I'm not speaking for a delegation, I'm not speaking for anybody, but as the person who's representing the most impacted district in the country, my constituents are upset. My constituents were upset about the first package because it is insulting to think that we can pass such a small amount of money in the context of not knowing when Congress is even going to reconvene, and pass such a small amount of money, pat ourselves on the back, and then leave town again. I am not here to support that. I understand that we keep being told this is going to be happening in the House bill when the Democrat-led bill is going to be bigger. In my district and in New York City and in our community, we have had more deaths than 9/11. Multiple times of 9/11 have happened in the time since Congress has recessed. So I'm not here with the luxury of time. I need legislation that is going to save people's lives. And the fact that Republicans do not want to have recurring payments, the fact that Republicans don't want to fund states and cities, the fact that Republicans don't want to guarantee people's health care is unacceptable to me. I know that is unacceptable to all of us. And how we come on this bill, every vote is extraordinarily personal. But as someone that has to make calls every single day to sons and daughters and widows and parishioners and church leaders and community boards, giving them my condolences every single day about people in our community who are dying, I am not here for a $5 bill. I'm not. And I will not insult my community with one. And that's all I got to say. I think it's important for us to understand the process, because there was a related question about UC and voice votes earlier. I think it's very important that we all understand the process behind this. And I'm sorry to get into the weeds, but procedurally, we need to know the context. So first you have unanimous consent, which would be passing the bill, assuming that there is complete unanimous consent in the House. That basically is presuming every member supports and every member does not support. Now, there was a statement earlier saying that the last bill was passed by unanimous consent. It actually was not. It was passed by a voice vote. So what happens is that you have unanimous consent, then you have one member, they did not try to pass by unanimous consent on the first time because they knew there was just a growing opposition around it. So it passed by a voice vote, by people kind of hollering out the yays and nays. Now, in order for there to be a recorded vote, if one person stands up and asks for a recorded vote, that is not sufficient to actually get that recorded vote. It's sufficient to block the unanimous consent and move it from a unanimous consent to a voice vote, but one person standing up is not sufficient to move from a voice vote to a recorded vote. You actually need according to House rules, you need 1/5 of the quorum, so about 44 members, to stand up in order to achieve a recorded vote. So the real question is not, is there one person to stand up to get a recorded vote, but are there 44 members willing to stand up and get that recorded vote? And so when it comes to that calculation, for us, and I believe Justin and Mosh and I came to a similar conclusion on the first one, which is that, to stand up and ask for a recorded vote when there are not 44 members, it would be essentially to needlessly endanger folks. So I think we need to figure out what the final text of this bill is first and foremost. I think one of the things that is not in this bill, thankfully, that was in the first bill, was this $500 billion to be leveraged to multi-trillion-dollar corrupt slush fund for Wall Street, which was, it added insult to the injury of an insufficient bill. But that kind of corrupt provision is not in this bill. So I think once again, at least so far. So once again, first of all, we need the final text in order to make that decision. But at the very least, what I'm hearing from Democratic leadership is to prepare for the conditions of a recorded vote. So that's just kind of a long way of saying we're not sure since we don't have the final. I'm not sure since I don't have the final text of the bill.